Hello everyone, I am Dr. Rujul Jhaveri, Obstetrician Gynecologist at SRCC Children's Hospital managed by Narayana Health at Haji Ali, Mumbai. January is observed as Birth Defects Awareness Month. This is a time when we as obstetricians and also pediatricians would like to raise awareness about birth defects. So what exactly is birth defect? As the name suggests, birth defects are not that the individual is defective. It is a medical term. These are disorders which are present from the time of birth or even before birth. Many of these conditions may be inherited or they may also be preventable. Just to be accurate and sensitive, we do not address these conditions as birth defects, but we use the specific names for it. Okay. Now, these birth defects can range from a simple disorder like a cleft lip or a cleft palate or to complex cardiac disorders. While many of these are treatable and, like I said, preventable, some of them may be lifelong and will need lifelong treatment. So while we observe this as a birth defect awareness month, a question for a to-be mother or a new mother would always be that what can I do to avoid or prevent these birth defects? First and foremost is good prenatal care. What do we mean by prenatal care? So whenever you're planning a pregnancy, it's always better to meet your obstetrician or a doctor. Especially if you have any pre-existing conditions like diabetes, because these will predispose you to certain congenital disorders. Or if you have hypertension, or if there is a family history of any genetic illnesses or any major illnesses which you feel that the doctor should be aware of. If you're currently taking any medications or you're not sure if they are safe to conceive upon. Second thing is folic acid. So folic acid is basically a vitamin supplement. It helps in the growth of the early embryo and the early fetus. So this is a very important vitamin which helps in the prevention of neural tube defects, which is one of the most common neurological disorder, congenital disorder. A minimum intake of 400 microgram of folic acid is very essential before pregnancy in the periconceptional time. Third thing is one cannot emphasize or re-emphasize about the importance of being fit. This includes taking a healthy diet, exercising, active physical lifestyle, avoiding alcohol intake, avoiding smoking and the use of recreational drugs. One should try and avoid infections wherever possible. Take your vaccinations on time. At workplace, you maintain a good hygiene. Avoid exposure to any harmful chemicals, if at all any. So yes, while pregnancy is an exciting journey, yes, such times it may become stressful. But being well prepared and knowing that you've done everything to remain healthy would be the best start that you can give to yourself and your baby.